Coronavirus is a respiratory disease. So, do you know the best way to breathe to avoid contracting it? The best way to breathe to avoid spreading it? And the best techniques to keep your lungs healthy so that you can survive it? This is what I wanted to find out when I sat down with Patrick McKeown, who is the best-selling author of The Oxygen Advantage and world's leading authority on the Breathwork breathing method. Patrick works with people with breathing issues, sleep apnea, snoring, asthma, panic, anxiety, as well as Olympians, athletes, MMA fighters. He's a true expert on everything related to the breath. And I'm going to show you now an excerpt of the interview where he discusses how you can use nasal breathing as a natural antiviral to avoid getting coronavirus. I think it's a shame, as Patrick agrees, that we are not being taught this. Nobody is talking about it. And this is something that I've taken up in my own life, and I'm encouraging family and friends to do the same thing. If you want to get access to the full 90-minute interview, make sure to subscribe because that's going to be released soon. But here is Patrick McKeown and I discussing coronavirus and how we can protect ourselves from it by breathing correctly.
What we already knew from 1988, that when you breathe through your nose, the pressure of oxygen in the blood increased by 10%. And you think of COVID now, I think it's unfortunate that nobody is talking about nasal breathing from two perspectives. Number one, you do have a gas, nitric oxide, that's released into the nasal cavity. Nitric oxide is antiviral. And there are currently, if you were to Google nitric oxide, COVID, clinical trials, you will see that there are clinical trials in the United States at the moment on nitric oxide as a potential treatment for COVID, but your nose produces this gas. So that's one reason. Now, yes, the inhaled gas, say, in the clinical trials might have a higher concentration, but you can also improve and increase the nitric oxide in the nose by humming and by breath holding. The other reasons that individuals should breathe through their nose is because COVID-19, the water particles that come from breathing are partly responsible for the transmission of it. And if you think it's not just during coughing and sneezing that this water vapor goes into an aerosol into the atmosphere and another individual then is inhaling those particles into their body, talking and breathing also do it. But nose breathing, as you breathe in, your nose moistens the incoming air coming into the body. But as you breathe out, your nose traps that moisture, keeps it in the body. So mouth breathers they emit a 42% greater water loss during breathing. So mouth breathers, if you have a person who is infected, and you can imagine if they're with family members, if that individual is a mouth breather, they are going to be emitting a lot more water particles into the atmosphere, increasing the risk of transmission of their family members, because the nose would be the organ of the body that's designed to try and trap and to hold on to that moisture and causing less of it to be released into the atmosphere.
When I watched your video, which I'll provide a link to on COVID, I was kind of just astounded how this information isn't being broadcast, because there are these like nightly sort of news reports on like the data, and there's good advice, wash your hands a lot. But I would imagine, based on the research that you've done, if there was some way of really encouraging everyone on planet Earth now to take up nasal breathing, there would be like a huge impact in the stats.
Yes.
Crazy. It's like a crazy thing.
Yeah, it just makes sense. But breathing just, I suppose people think it's too simple. Now, washing hands, you could argue, is very simple. I don't know. I don't have an answer. And I also use that video as a point of how can you breathe to improve alveolar ventilation? And if you think of every breath that we take into the body, for example, here's my anatomical model of the nose. So when you take air, you take a breath of air into the body, you're going to leave a part of that air. Part of that air, every breath that you take, part of it remains in the nasal cavity, part of it remains in your throat, in the trachea, in the bronchi, in the bronchioles. So every breath that you take, 150 milliliters of that air doesn't reach the small air sacs in the lungs for ventilation to take place. If you are breathing 12 breaths per minute, just to give you an example, and if the average size of the breath, the normal size, it's a half a liter, 12 by a half a liter is 6 liters. So in the minute, you are taking 6 liters of air into your nose. But how much of that air actually gets into the small air sacs? You have to subtract the amount of air that stays in dead space because it doesn't get to the small air sacs. And the amount of air that stays in dead space is, of course, going to be 12 by 150. So the amount of air that gets into the small air sacs is 4.2 liters. You take 6 liters of air into your nose and 4.2 liters gets into the small air sacs. Now, if you were to bring down your breathing during rest from 12 breaths down to 6 breaths, you are wasting less air in dead space because you've got 6 less breaths per minute and 6 by 150. And that's quite significant. If you look at the maths this way, I have 6 breaths per minute. I'm going to increase the tidal volume proportionately to 1,000 mil. I'm still taking 6 liters of air into my nose, but the amount of air that's got down into the small air sacs has increased from 4.2 to 5.1. There is a 20% improvement in breathing efficiency by slowing down the respiratory rate. Here's the difference with mouth breathing and nose breathing. Mouth breathing is inevitably fast and shallow breathing. It's highly inefficient. And with that, you don't harness nasal nitric oxide. Nitric oxide, not just as an antiviral, but nitric oxide to sterilize the incoming air, and nitric oxide to redistribute the blood throughout the lungs. So in terms of blood oxygen saturation, I could send you on paper. They looked at an individual's climbing Kilimanjaro. These individuals were at a pretty decent height. I can't remember, maybe 5,000 meters, but it's a fairly significant height. And with that, their blood oxygen saturation dropped down to 80%, which is severe hypoxia. They had the individuals slow their breathing down to 6 breaths per minute, and within a few minutes, their blood oxygen saturation increased from 80% to 89%. Now, the problem with COVID is low blood oxygen saturation. And when these individuals are feeling breathless, they are going to breathe fast and shallow, and they are going to breathe entirely the wrong way to breathe to increase their alveolar ventilation, to increase their blood oxygen saturation. So if, for instance, individuals, I don't have a pulse oximeter, actually I do. So here's pulse oximetry here. That one didn't work anyway. So you see I'm just going to check now. So yeah, so there's a little red light on the inside of it, and it's a finger probe that's put on your finger. And it's detecting the saturation of your hemoglobin with oxygen.
Yeah.
And I remember having a client coming in, she had chronic heart failure. And I had her go for a walk, and her blood oxygen saturation went from normal, which is 95 to 99%. It dropped down to 92% during the walk. And it's going into mild hypoxia. It would be a cause of concern. And I looked at her breathing. She was breathing, mouth breathing, fast breathing, shallow breathing. And I said, okay, I would rather if you don't breathe that way, because this is what's happening. You are not harnessing oxygen. You are not, utilizing your breathing efficiently. So I had her put her hands either side of her lower 2 ribs, just where at the base of the ribs, just where it meets the abdomen, just where the diaphragm is. And I said to her, now I would like you to walk. And as you breathe in, I want you to breathe in 2, 3, 4, out 3, 4, 5, 6. So I had her breathe low and slow through her nose, but not over breathing, because we don't want to breathe hard, because that's not going to have a good effect either. So we want to have a balance between the biochemistry, the biomechanics, and the cadence of the breath. Her blood oxygen saturation increased from 92% to 96% within about a minute of doing that exercise. And these are simple things, that should be out there, that individuals who are susceptible to COVID and who have the infection, that they are it's possible that it is going to drop their blood oxygen saturation. that they could be practicing breathing techniques at home to improve their SpO2.